Dr. Daniel Amen is a psychiatrist, brain imaging expert, best-selling author, and medical director of the Amen Clinics. He has pioneered the use of brain imaging in clinical psychiatric practice and is a noted expert in the field of the brain and behavior. Dr. Amen's breakthrough research and insights provide hope and more effective treatment for millions of people today.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological, if you will. In the research that I've done, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, change your brain, change your life, and that's what we've seen. Well, today we're going to talk about anxiety, depression, and bipolar disorder, and we're going to talk about them from a brain perspective, and we'll also talk about how to treat them effectively. I like to start with this case because Tommy read my book, Change Your Brain, Change Your Life, and was able to diagnose himself, and I like that. I was in the Fairfield Clinic, our Northern California clinic, last year, and my office manager grabbed me and she said, "You have to see Tommy." And I said, "Why?" Because I was busy. And, "Oh, you have to see him. He's from Orlando, Florida. He's very cute, 9 years old. He read your book, Change Your Brain, Change Your Life." I'm like, now I'm paying attention. And she then said he sleeps with the book, which made me think he's a weird child. And so I went in, I met him, 9 years old, cute as a button, big blue eyes, blonde hair. And he said, "Dr. Amen." He recognized me from the picture in the book. "Dr. Amen." He said, "I have a left temporal lobe problem." I said, "Really?" So how do you know that? He said, "I read the book. I took the checklist in the book." I said, "But how do you really know that?" He got thoughtful and he said, "I have a bad temper. And I don't want to have a bad temper." And you say in the book, people with bad temper sometimes have left temporal lobe problems. He said, "And I used to see ghosts." I said, "What do you mean you used to see ghosts?" He said, "I used to see these green things float in front of my eyes, the green clouds, and I didn't know what they were. I thought they were ghosts, and they used to scare me." And he said, "And last year I tried to kill myself because I had such bad thoughts in my head." And you say suicide is often associated with left temporal lobe problems. Doctor had put him on Prozac, made him significantly worse. And so I said, "Well, Tommy, have you seen your scan?" And he said, "No." And what you're looking at are SPECT scans, looking at blood flow and activity patterns. And the image on the left is a healthy scan, full, even, symmetrical activity. It looks really pretty. So look at the image on the right. This is a 9-year-old scan. And if you look right about in the middle, on the right side, you see those divots. It's his left temporal lobe. 9 years old, predicts his own scan. It's amazing. And as he sat there, he was so proud of himself. One, he predicted it. But two, it helped him to get rid of the shame. Because he thought he was a bad boy, or he wasn't good enough, or sometimes it's God doesn't love me enough that God would let me suffer. I opened up my book, Healing Anxiety and Depression, with the story of a woman that had a severe panic disorder. And she prayed that God would take it away. And she still had the panic disorder despite the prayer. And over time, she just stopped talking to God. Thought God didn't care. And then when we scanned her, it's like, you have a medical problem. God cares. He just wants you to get it treated. And she had to change her sort of whole perception of how she communicated and talked to God based on the understanding of her underlying problem. A lot of people are suffering with anxiety and depression. The two most common psychiatric disorders in the world, anxiety being one and depression being two. And a lot of people go untreated. So, you've seen this before. The 9-year-old can understand it. Can it really be science? It's a cartoon from Peanuts where Peppermint Patty says, "What are you reading, Franklin?" And Franklin says, "It's a book on psychology. From what I understand, it seems to be pretty good." And Patty says, "Forget it, Franklin. No book on psychology can be any good if one understands it." And that's what we're trying to do in this course, is like get rid of that and make this easy to understand. So, as we have talked about, a lot of my work is based on a study called brain SPECT imaging that looks at blood flow and activity. And it's really easy to understand because we're looking for 3 things: good activity, too little, or too much. And what we're going to talk about today are the brain systems underlying anxiety and depression and bipolar disorder, and then we'll talk about treating them. And this is the camera. And I hope all of you who signed up for getting Brain in the News are getting it. I've been writing about it. And last week I wrote about technology on Mars. You know, we can take pictures on Mars with spirit and opportunity. And it just really irritated me that, you know, I'm looking on, you know, the front page of USA Today and I'm seeing, you know, red dirt and rocks. And we spend billions of dollars to do that. But yet you can try and kill yourself today in LA. And no one will look at your brain. You know, that we don't use technology for what may in fact be the most important endeavor, which is understanding the mind. Because that, you know, the brain controls everything that you do. Again, just looking at a healthy brain. Now we're looking at the outside surface of the brain. And here we're looking at the top 45% of brain activity. What we see is nice looking brains, full, even, symmetrical. As part of our normal study, we did a normal couple last week, and we're a little hesitant about the guy because we thought he drank too much. We were really right when we saw his scan. I mean, it's very clear he should stop. His wife, oh my goodness, the most beautiful brain next to my mother. I mean, amazingly beautiful, but really it looked healthy. So here we're looking at the outside surface of the brain, where what you see is full, even, symmetrical activity. Now what may be more important for today are the hot spots, because we find a lot of different kinds of anxiety and depression are related to too much activity. Okay? Not all of them. As we'll see, they're different types, but what we see in this view is blue is average activity, red is the top 15%. By and large, it is in the back part of the brain. Why? Because that's where the cerebellum is, that has 50% of the brain's neurons. Okay? What we see with obsessiveness is the frontal lobes are on fire. We see with people who have panic disorders, their basal ganglia are working really hard. We see with bipolar disorder, the whole thing is hot. It's amazing when you look at someone who's in a manic phase. It's like, that's why you have to calm it down. I put this slide in to just talk about strokes for a minute. Strokes, you know, are when a blood vessel breaks or a blood clot goes and plugs a vein or it plugs an artery and it chokes off blood supply to that area and tissue dies. This is a left-sided stroke. And what we know is that strokes to the left hemisphere cause depression in 60% of the cases. So within a year, if you have a stroke to the left side, you have a 60% chance of getting depressed. It's very important. It's also very important if somebody has a heart attack. There's a very high incidence of depression after a heart attack. And a lot of doctors don't know that. And a lot of families don't know that. I mean, it should just be part of what we tell people on cardiology unit. You have a heart attack, you should watch for symptoms of depression. You know, sleep problems, sadness, irritability, suicidal thoughts, trouble focusing where you didn't have trouble focusing before. I have to tell you a sad story. When I was in medical school, my grandpa had a heart attack. And he's just different afterward. And he had a heart attack on the bottom of his heart. Bottom of your heart sits on a muscle called the diaphragm. That's a big muscle that separates your chest cavity from your belly. And the heart attack there actually damaged a little bit of his diaphragm. And he had terrible hiccups. Because if you damage the diaphragm, it's contracting. It's like goes into, he had hiccups. And he went to doctor after doctor, and finally they actually did a surgery to cut the nerve to the diaphragm. And it helped a little bit. But what I didn't know then is that 60% of people who have heart attacks get depressed. And this very bubbly, sweet, loving man was crying and not sleeping and sad. And nobody knew about it until I read about it. Like, what's the matter with him? Because he was a candy maker. And, he was like a jolly, wonderful grandpa. And it's amazing. People miss that diagnosis a lot. And why is it a problem to miss depression or to miss anxiety disorder? Well, an obvious problem is suicide is the 8th leading cause of death in the United States. That's an obvious problem. But if you are depressed, you are much more likely to have your wife leave you or your husband leave you. It causes great marital strife. And as we go through some of the symptoms, you'll see why it causes great marital strife. They're not interested in sex anymore. They can't concentrate. They're mad. They're irritable. And they put a negative spin on everything. It's like the glass is half empty. And you can fill the glass to the top, and it's still half empty. They can't see what's good about their life. Alzheimer's disease, which we'll talk a lot about later in the course, is a brain disorder. We see bilateral decreases in the temporal lobes and in the parietal lobe. But there's something that looks like Alzheimer's disease that we call pseudo dementia. And what that means is dementia means losing cognitive ability, especially as you age. It's not due to Alzheimer's disease, not due to a stroke, it's due to depression. That people who are depressed in the elderly may look like they have senility, and put them on an antidepressant, and they might get normal. I don't know if I told you, but the first 10 cases I ordered brain scans on in 1991, they were touched by God. I totally believe that, because they were like the coolest, most amazing cases that made me feel like, well, how could I ever do anything else? And one of the cases was Matilda. And Matilda was 69 years old. And she came into our clinic. Actually, she didn't come to the clinic. She came to the hospital because she'd almost burned down her house because she left something cooking on the stove. And she was forgetful. And she had bad judgment. And she was disheveled. And she wasn't taking good care of herself. And she was getting lost. And this one day, she leaves something cooking on the stove and forgot about it and nearly burned her house down. At which point, her whole family gets mobilized. Grandma's got to go to an old folks home, right? Grandma's got to go to a care home because otherwise she's going to kill herself. And one of her daughters was a nurse and said, before we send Grandma away, we're going to put her in the hospital, we're going to get an evaluation. And just by chance, if you believe in chance, I'd just been to the lecture earlier in the week on brain scans, and Matilda came on my service. And as I was talking to her, it seemed to me like she had Alzheimer's disease. But, I'm not that good at guessing what's going on in your brain. And so I ordered a scan, and it didn't look at all like the one we see on the screen. Her emotional center was really hot. And so I'm in the library. What does this mean? And there were some studies associating it with depression. And already by 1991, there were a number of studies saying that Alzheimer's disease was bilateral, both sides, decreased activity in her parietal lobes and in her temporal lobe. And she didn't have that. And so I noticed in her history, one other doctor had thought about pseudo dementia, put her on a medicine called Elavil, is an old antidepressant that has more side effects than any of the other ones. And Elavil caused her bladder to stop working. So even on a small dose. So they stopped it, and nobody thought about depression. After I saw the scan, I went, maybe we should try a better antidepressant. And so I put her on Wellbutrin. And Matilda isolated herself. Wasn't talking to anybody on the ward. Just looked blank. After a week, she starts talking. After 2 weeks, she starts socializing. After 3 weeks, she starts taking care of other people on the ward. And after a month, when I'm sending her home, she looks at me and her eyes are now bright. She said, you know, it's like coming out of a fog. She said, Dr. Amen, they took my driver's license away. She'd been in 4 accidents. She said, would you write the DMV a letter for me so I can get my driver's license back? And my first comment to her was, you know, Matilda, I drive on the same highways you drive on. I'll make a deal with you. If you take your medicine for 6 months and you let me rescan you after 6 months and you're better and your brain is better, I'll write the DMV a letter for you. 6 months later, I saw her every month. 6 months later, we got a follow-up scan. It was normal. And I wrote the DMV a letter. And now, what is she? 84. She still drives. Can you imagine if you missed that diagnosis, what happened? She's in an old folks home. And now, she's more isolated. And she's more depressed, which is going to make her look more demented. Her immune system will kill her. Because when you get depressed, your immune system doesn't work right. Another reason it's very important to treat depression, because you're at a higher risk for cancer. You're also at a higher risk for dementia. Now we sort of understand why. Head injuries are so important to depression. Head injuries, especially to the left side. When you get damage to the left side of the brain, you're much more likely to get angry, irritable, be suicidal. So it's very important to think and ask about head injuries. And as we talked about before, more than once, 5 times. Has anybody done that in any of their clinical work to like go, have you had a head injury? Are you sure? Have you ever fallen out of a tree, fell out? I mean, it's just amazing. You remember Dr. Dworsky who was here? Well, she got a scan. And she said, no, no, no. The 9th time she said yes. It was so interesting. I was 8 years old. I fell in the tub, bashed my chin. Even if you know, sometimes you forget. And why do people with anxiety disorders or depression use drugs? To help themselves. And what are the drugs that they choose to abuse? Well, some of them use cocaine and methamphetamines because they have overall decreased activity and it wakes them up. Other people use alcohol. Calms things down. It's sort of like putting water on a fire. It's sort of putting poison on fire, but it calms things down. And heroin. It is so interesting. If you have a patient that uses heroin or heroin-like drugs, methadone, painkillers, they often have the kind of depression that responds to acupuncture. Well, how cool is that? Acupuncture increases natural endorphin. So you bet it's a treatment that you should be thinking about in depression. Now what I see as a psychiatrist, patients come into me and they go, you know, Dr. Amen, I had my teeth worked on and the doctor, the dentist gave me Vicodin as a painkiller. And I have to tell you, when I took one Vicodin, I felt normal for the first time in my whole life. do not give them Vicodin. Vicodin's addictive. It's not a good treatment for depression, but what it does is it gives you a hint on what they might respond to, and acupuncture would be one of the first things that I would think about. People with anxiety disorders use marijuana because it settles them down. People with depression use marijuana because it settles them down. The problem is it settles everything down. And, the people who've smoked a lot of pot over their life, almost all of them complain of memory problems because it damages activity in their temporal lobe. Now I want to go over 7 different types of anxiety and depression. One, I want to leave you with the idea that they're not one thing. They're not single or simple disorders. They're complicated disorders, and you need to know what you're treating. And I think giving somebody the diagnosis of depression is like giving them the diagnosis of chest pain. So why don't we give people the diagnosis of chest pain? It's too general. Why else? The symptom. It doesn't tell you what's causing it. I mean, what are the things that can cause chest pain? Heart attack, anxiety, panic disorder. I'm sorry? A muscle tear? You bet. You have a rib injury, you tear the muscles between your ribs. What else? So we have heart, bone, brain, stomach, indigestion. You can have reflux esophagitis. You have a kidney ailment that causes chest pain because they're up high in your back. You have a spinal problem that causes indigestion. But what we do in mental health is go, oh, you're depressed. Take cognitive behavioral therapy, you'll be fine. It's a little on the simple side. Right? You want to find out what's it from? What are things that can cause depression? Primary etiologies of depression, what can they be? Be your thyroid. Thyroid's low. Or it can be high and you are freaked out, having panic attacks all over the place. So it could be from your neck. What else? You can have emotional trauma. That can cause anxiety and depression. You bet. What else? Physical things can cause anxiety and depression. We talked about thyroid. Did you know that the most common presenting symptom for pancreatic cancer is depression? You get a 65-year-old with new onset depression, never had depression their whole life, somebody needs to do an MRI of their belly. Don't just put them on Prozac. So you have to think about what are the other things that can cause. Anemia can cause depression. Liver problems can cause depression. You can inherit depression. I mean, it can be what we think of as a primary depression, but it's important to think of these as symptoms, and you want to be much better at describing what are the underlying causes. In my imaging work, I found anxiety and depression are not single, simple disorders. And you shouldn't even talk about them separately because they occur together more than they occur separately. If you get the diagnosis of a panic disorder, 70% of the time you'll also meet the criteria for depression. If you get a diagnosis of depression, about 75% of the time you'll also meet the criteria for an anxiety disorder. So to talk about them as if they are separate or simple disorders is silly. Now, in looking at the different types, when I listed them, I actually listed 2 pure types because sometimes you see them. But of all the types, the first 2 are the least common. Type 1 is what we call pure anxiety. And that's where we see the only things that we see on the scan, basal ganglia are fired up. And the basal ganglia, deep structures in the brain. There are 4 different parts to the basal ganglia. The things that we can see on scans are the caudate, called the head of the caudate nucleus, a large structure. It's involved in thought anxiety, we think. And the putamen, a little bit farther back, it's involved in motor anxiety. So when people get anxious, they have motor symptoms, right? I mean, what are some of the motor symptoms associated with anxiety problems? Well, you bet. Biting their nails. Muscle tension, so they get headaches. And those headaches are typically called tension headaches. And it feels like there's a band around their forehead, like somebody's got a vice squeezing their forehead, and somebody is in the back of their neck digging their thumbs into that muscle in the back of your neck. So, bifrontal and upper neck tension. What else? Physical symptoms associated with anxiety. Stomach aches, very common. They have butterflies. What else? Chest pain, you bet. We just talked about it. Chest pain. And then, if they hold their hand out and they're nervous, what happens to their hand? Shake. Sweating, you bet. So they have a lot of physicals. And we talk about this thing called somatoform disorders. And what does that mean? It means your medical illness is basically due to your level of anxiety. And when we see overactivity in the basal ganglia, we often see people, one, who are worried about their health, and two, they tend to have more physical stress symptoms, like irritable bowel syndrome. It can be a physical stress syndrome, or chronic tension in their body. Just as a review, the basal ganglia integrate feeling and movement, sort of control the body's idle. They modulate anxiety, involved in continuous smooth motor movement, so they're involved in handwriting. Think of them mostly involved with motor function and anxiety. So when they work too hard, people feel anxious. Now, they're also conflict avoidant. Why are they conflict avoidant? Because conflict gets their heart going fast and reminds them of when they were anxious. And they do everything they can to avoid feeling anxious. So they won't confront people. So these are, in an intimate relationship, this is someone who won't talk about the things that's bothering her and won't talk about it. And then all of a sudden she explodes because she just can't keep it in anymore. Or she has a lot of headaches because she won't talk about what's going on in their relationship. And so, not tonight, honey, I have a headache. Maybe due, not because she's married to a difficult person, but she's trained him that she won't deal with anxiety. So he always gets his way. But she's chronically irritated, but not sharing it. And so, can you see how, in a sense, her anxiety trains him to be more difficult than he needs to be, because she's never said anything like, don't talk to me like that, or I don't like it when you do that. So he has no clue. They predict the worst. They are filled with what we call ants, automatic negative thoughts. And the automatic negative thoughts that people with anxiety disorders have are fortune-telling ants. They predict the worst, and then they make it worse. We're going to spend some time talking about ant therapy today. Sometimes their basal ganglia work so hard they just can't stop working. They're like the Energizer Bunny. Now, if the basal ganglia get hurt, or they're too low, as happens in Parkinson's disease, they have low motivation. They have low energy, and they often get depressed. So pure anxiety, what you're going to see are both physical and cognitive anxious symptoms. Nervousness, panic attacks. They avoid situations that they think are at all going to make them nervous. They have a lot of muscle tension. Their heart pounds. They have nausea, dizziness. Masterful at predicting the worst. They have fears and phobias sometimes. They avoid conflict. They're so worried about what other people think of them. So I teach them the 18-40-60 rule, which says when you're 18, you worry about what everybody's thinking of you. When you're 40, you don't care what anybody thinks of you. And when you're 60, you realize nobody's been thinking about you at all. People spend their days worrying and thinking about themselves, not you. But they don't know that. I mean, they're just racked with social anxiety. They startle easily. They freeze more in social situations. They're shy, they're timid, easily embarrassed. And they sometimes bite their fingernails. A whole bunch of DSM-4 diagnoses that would go with this type, but mostly generalized anxiety disorders, somatoform disorders, phobias, and often panic attacks. So how you treat this? This is actually my least favorite type to give medication to. You can do very cool things with this type. Cognitive behavioral therapy, we call it ant therapy. Teach them about their thoughts. They don't have to believe every thought that goes through their mind. Meditation, hypnosis, relaxation, biofeedback, all are self-regulation techniques. I have to tell you, I was here for my 25th anniversary. And one of my friends, when I was here, "Oh, you do hypnosis?" Like it was of the devil. You know, aren't you opening somebody's mind to the devil? And I got incensed. I said, I don't do that to people. I said, you think God is going to use me to open up some? And I just think it's a silly argument, to tell you the truth. Hypnosis has been part of medicine for a very long time. It's very powerful. And if you use it in the right context, you can help somebody really get in touch with themselves. And you can get access to memory that you couldn't get access to otherwise. So in the right situation, I mean, if you're going out to a specific church and you think this is going to be helpful, my advice, call it guided imagery. Because it's basically the same thing, except you're using some technique to help people heal. But it's basically guided imagery. Do you know we all get into hypnotic states all the time? How we tell if somebody's in a hypnotic state is, one, if they can sit still for a long time. Two, does time get distorted? Think about the last time you were in a great movie. Well, that great movie may have taken 2 or 3 hours on the screen. In your mind, because you really got into it, it seemed like it went by in 20 minutes. Or I don't know if you've ever driven for a long ways, but there's this thing called highway hypnosis, where you like drive through a city, but you don't remember the city. It's like, it's 3 hours later, what happened to the time? And obviously, because you're not dead, you were awake. So, biofeedback is one of the coolest treatments. I don't know if you get any training in it, but it is so wonderful. What you do in biofeedback is you hook somebody's body up to computers, and you measure their hand temperature, their heart rate, their muscle tension, how they breathe, even how much their hands sweat, and brainwave activity. And you can see it on a screen. Moment by moment, you can see what's going on in their bodies. And then, biofeedback means you're getting feedback on your body moment by moment. And if I give you feedback on your hand temperature, you can teach yourself how to change it. Typically, with people with anxiety disorders, they have cold hands. Do you know you can actually teach somebody to warm their own hands with their brain? How cool is that? And little kids are very good at it, because little kids don't have the idea that it's hard to do. They don't have the idea that they can't do it. So it's like a computer game for them. Warm your hands. How do I do that? Why don't you just try and see if you can do it? And so, you know, they get these cool images in their head, like, I think I'll get more blood flow to my hand. And they'll make it happen. It's very cool. Now, for adults, you have to give them structured exercises to do. Which is, I mean, what do you think we would do to help you warm your hand? Besides put your hands under hot water. Images. We have people think of warming things. Like, what would be images that you think would help you warm your hands? A hot cup of decaf coffee. That's right. Hot coffee, hot tea, hot cocoa. Just holding a warm cup. You can already feel increased blood flow to your hands if you do that. What else? The sun. And especially since we, here in Newport Beach, putting your hands in the sand. Whoa. I love that. Right? Or being out on the patio and just let the sun warm you. What else? Putting gloves on. That'll work. Thinking about, no, because you're doing this just with your brain. So thinking of it, putting your hands in front of a fire. You bet. Or crawling under the covers. A warm bed. Or holding a puppy. Or your cat. Or the hand of somebody that you love who has warm hands. Right? Or holding the body of somebody you love who has a warm back. I mean, you just work with it. And then what you do is you write down these images. And then, now this is why their hand is hooked up to the computer, and you can see moment by moment what's going on with their hand temperature.